Welcome back. This video is the second part of nutrition in metabolic stress. As a quick review from the last video, we learned how three body systems respond to stressors. The first was a hormonal response that increased metabolism, which means the calorie demand is much higher. The hormones also induced a breakdown of lean tissue, glycogen, and fat to mobilize the energy nutrients. The inflammatory response changed blood flow and increased both blood clotting and immune factors. The GI tract was affected with lower motility. So let's just keep these factors in mind as we discuss our nutrition therapy. This is a really good graphic to explain the effect of nutrition with an acute stressor. At the beginning of this graphic, it depicts where the stressor begins. As he enters the acute phase, this is where we see the hormonal and inflammatory responses take effect. Nutrients are mobilized into blood, especially with protein broken down from lean tissue. Metabolism increases, causing the body to break down body stores even further. In other words, he is completely running off of his body until we initiate nutrition therapy. The longer it takes to get nutrition started, the more the body is depleted, decreasing his chances of fighting off infection and recovering. Remember, every cell in your body, whether immune cells, blood cells, hormones, etc., are made of protein and other nutrients. The more the body is depleted, the harder it is to recover. By the time we get to resistance, he is at the height of hypermetabolism and catabolism. If we do not have adequate nutrition established by this point, his body will continue to break down rather than healing and recovering, leading to exhaustion. We may or may not get him out of this. If we do, it will likely be a long process. If we do introduce adequate nutrition during the acute phase, we are able to minimize the body losses, allowing it to fight off infection, heal, and recover. I think this graphic does such a great job of explaining the importance. Now, this particular graphic demonstrates the process of an acute stressor, which is usually a very sudden onset with severe effects, but short term, lasting about 7 to 10 days. That means the height of resistance usually occurs somewhere around 3 to 5 days. So those of you going into nursing, when you have that dietitian coming around day 3 or 4 asking, where is the nutrition? Pay attention, because it's with good reason. The dietitian understands the effects of stressors on the body and what will happen if we don't get adequate nutrition initiated. So now let's discuss the nutrition therapy we need for these stressors. And before we get into details, we should establish our goals. Understanding the body responses to stress, we know the body's catabolic and in high energy demand. So our goal is to minimize the nutrient losses, and then once the acute phase is over, we want to restore any deficiencies, promoting nitrogen balance. The immediate nutrition concern in any severe stress is to restore adequate fluid. Without appropriate level of fluid and electrolytes, circulation and normal body processes cannot continue. Of course, the stressor affecting the body will also be a top priority for medical staff, but nutritionally speaking, hydration is most important. Depending upon the stressor and reaction from the body, restoring adequate hydration may include IVs with fluid electrolytes, medication, or draining excess fluid. The medical staff must be very careful to ensure enough fluid is in the body to restore circulation, allowing nutrients, oxygen, and medications to reach cells, as well as allow filtration and removal of toxins in the body. Once the individual is stabilized, the other nutrients may be addressed. As I mentioned earlier, initiating nutrition during the acute phase is critical to the recovery process. Recall from the first video that severe stress causes hypermetabolism, hyperglycemia, and protein breakdown with negative nitrogen balance. Inadequate calories may affect organ function, decreased wound healing, increased infection risk, and impair ability to recover from the stress. So it is very important to establish adequate nutrition as soon as the individual is stable. At the same time, we do not want to provide excessive calories, as this will increase CO2 production. I briefly mentioned this in the metabolism videos, You remember those videos detailing glycolysis, Krebs cycle, and electron transport, right? Well, if you recall, as you are breaking down your carbs, fats, and proteins to obtain energy from them, several of the steps have a byproduct of CO2. This CO2 then has to be removed from the body through respiration. So the more calories or energy nutrients you provide to the body, the more CO2 is produced, causing more demand on the heart and lungs. We do not want to cause more work on the organ systems when we already have during severe stressors. Avoidance of overfeeding is even more important when the patient is in respiratory failure. So finding the right amount of calories can feel like walking a tightrope. Too few calories can affect healing, organ function, immunity, and recovery, while too many calories can overwork respiratory functions. It's a precarious position that the dietitian must get right. The good news is the dietitian is the one to set the goals for calorie, protein, and micronutrient needs. But I want to give you a quick overview of how the dietitian determines these needs. If you recall from the weight management chapter, the amount of calories a person needs to consume to maintain body mass is equal to energy expenditure. Energy expenditure is made up of basal metabolic rate, physical activity, and a very small amount from the thermic effect of food. A person with a stressor is not much different. They have the same basal needs. So the dietitian uses some very complex formulas to determine these basal calorie needs. You can see two different formulas on the screen. Note the formulas take into account not only height and weight, but age and gender as well. These formulas are used to determine the resting metabolic rate of an individual, whether healthy or undergoing a stress. If this were a healthy individual, the dietitian would then consider the individual's physical activity. But in the case of respiratory and metabolic stress, the individual is bedridden and has no physical activity to consider. While the individual may have no physical activity to consider, he or she does have a higher calorie demand due to the stressor. So instead of an activity factor, the dietitian considers a stress factor. This slide demonstrates the process. First, the dietitian calculates the resting metabolic rate for the individual using the formula I described on the previous slide. Then multiplies by the appropriate stress factor to determine the amount of calories the person needs. Sometimes adjustments must be made for higher demand if the person has additional stressors, such as on a ventilator or having a fever. If the patient is obese, the dietitian may also make adjustments for lower calories. Once the calorie needs are determined, the dietitian calculates the appropriate amount of carbohydrate, fat, and protein to make up those necessary calories. The specifics of how much of each nutrient is needed depends on the condition of the patient. The dietitian will use various factors from the assessment, including blood sugars, which are often elevated during stress, blood proteins, which are usually low, hydration levels, organ function, immune factors, etc. But the main premise you need to take away is that carbohydrate and lipids will be supplied in adequate amounts to spare protein from being used as an energy source. Remember, these individuals are hypermetabolic and in negative nitrogen balance. Our goal is to minimize losses by 1, providing enough calories, and 2, preventing protein catabolism. We do that by providing ample calories in carbs and fats, as well as the right amount of protein. Because we are trying to prevent protein from being used as a calorie source, we do not calculate it in terms of percent of calories. Instead, we calculate the protein based on body weight. This was discussed briefly in the protein chapter. The recommended amount of protein for a normal individual is 0.8 grams of protein per kilogram of body weight. Depending on the level and type of stress to the body, the protein factor increases to 1 to 3 grams per kilogram of body weight. Again, determining protein needs is the job of the dietitian, but it is important for you to know the normal requirement of 0.8 grams per kilo and that higher protein factors are used with stress and most diseases. There are a few additional nutrients that are important to note. 2 amino acids are often added to the nutrition plan in severely stressed individuals. Both glutamine and arginine have been found to improve immune function, preserve muscle mass, and promote healing. You will often find these amino acids added to the tube feed formulas designed for metabolic and respiratory stress. The micronutrients we are most likely to increase with stressors are vitamins A and C, as well as the mineral zinc. These three micronutrients have critical roles in immunity and healing. They may be supplemented in higher amounts during stressors. Ideally, we always prefer to provide nutrition through an oral diet. However, in the case of severe stressors, we often do not have this luxury. The next best choice is enteral nutrition or tube feeding. Providing nutrition enterally can be challenging though. As I mentioned in part 1 of the metabolic stressors video, one of the body responses to stress is decreased gastric motility. This means the stomach may not move contents into the small intestine very well. Generally, the doctor will try treating this with medication. We have meds that are often successful at increasing motility. If we are not able to use the GI tract, the last resort is parenteral nutrition. Now, due to the high calorie demand, PPN or peripheral parenteral nutrition would not be indicated. So TPN would be used. But with TPN comes a high risk of infection, which is even more dangerous in the metabolically stressed individual. Again, TPN is a last resort, only when the gut cannot be used. I guess that wraps up our segment on nutrition in metabolic stress. Thanks for joining me.